The slides and presentation that I will be doing is the respiratory system. In the bottom right of the corner is all the organs and structures that will later be talked about that are in the respiratory system. What does the respiratory system mean? The respiratory system is made up of organs and structures in the body that allow us to breathe. It is made up of lungs. We have a right and left lung. Also, it is made up from our airways, which is the bronchus, trachea, larynx, esophagus, and pharynx. And also our sinuses, our nasal cavity, and our oral cavity. Also, it includes our diaphragm. Our diaphragm contracts when we are pushing out all the air in our lungs, so like when we're releasing carbon dioxide, and then when it releases, that is when we're taking in oxygen. And also our vocal cords, which I will later talk about in the slides. The main function is to help us breathe, to breathe in oxygen and out carbon dioxide. The respiratory system protects us from harmful germs and organisms that are in the airway, in the air. The respiratory system helps us and lets us speak and smell. The ribs protect the lungs, also known as the rib cage. Muscles and blood vessels are supported in the lungs as well, and I will be showing a picture of the blood vessels and muscles in later slide. Experiences with the respiratory system. Well, we experience this one every day and all the time, is breathing. We experience that one much more than like the illnesses or the trouble breathing. This is another one that we experience, is gas exchange. We might not know that we're experiencing it, but we are. It is happening in our lungs. The gas exchange is when the air you inhale moves the blood, and when you breathe out, it moves the blood into your lungs. The respiratory illnesses that we can face, especially right now, is cold, flu, asthma, COPD, etc. There's so many out. Some other things that we can experience with the respiratory system is trouble breathing, trouble with releasing all the air out of our lungs, which can lead to low blood oxygen levels and high blood carbon dioxide levels, which could be very dangerous. The importance of the respiratory system. It is a vital system that is essential for us to live. The brain controls the rate that we breathe based on how much the body needs. When we are breathing, the body is pulling oxygen from the cells and replacing it with new oxygen that is coming in. Then when we breathe out, the waste product, which is the carbon dioxide, is being released out of our bodies. Triggering breathing is the contract and relaxing of the diaphragm and our intercostal muscles that are in the ribs. And in this picture, it shows the muscles that are around the lungs, that are just around the lungs. This one shows the lungs, and this part shows the muscles that are also on top of the lungs. And then this is all the blood vessels that go onto both sides of your lungs. And then this image down here, I will explain later, but this is part of our gas exchange process that I will talk about later. Information about the respiratory system. The respiratory system lets us talk by running air over the vocal cords. Sounds of the voice is because the thicker and longer you have for vocal cords, the deeper your voice is going to be, If you have thin vocal cords and short ones, then your voice is going to be pretty high up there. So it is based also on the tension, so how much is being pulled when you do speak, based on the deeper or higher of your voice, the length, also the shape of your chest. So especially like when you're a kid, your chest size is pretty small because you're still growing up. So that's also going to affect our voice. That's why we go through so many different voice changes. And it's also how much we release air. Some people, oxygen levels are much higher or lower than others. It's really how much your lungs can release. The lungs are the main organ of the respiratory system. Lungs are wrapped around in a membrane called pleura. And also going back to the picture where it showed the gas exchange, which was, give me 1 second to go back, which was in this picture, the previous slide. It looks like giant sponges with mini air sacs on the inside of them. So it is like giant sponge, and then the little holes in the sponge are like the air sacs. And the air sacs are called alveoli. Each air sac has a fine mesh-like capillary that is going and filtering the gas exchange that's kind of filtering our oxygen to carbon dioxide. Some tools to help us breathe. These are some pretty big ones that you will see most often. This one on the left side is a breathing exercise to strengthen the output of breath. So you see a lot of this with people that are having troubles with their oxygen level. Their oxygen level could be low, which our oxygen level are more safe, and like our oxygen level, if you're healthy, normal health, I would say, is anywhere from 90 to 100. We normally want you in that range, but there is some patients that do have a lower oxygen level, which then they would use some of these methods. The breathing exercise is when you push air out, these balls will rise, and just depending on how much you release, it tells you how much you do release. The next one is a CPAP machine. You see these more on patients that have not just patients. You might see this with people that sleep at night. This is when they stop breathing throughout the night, so they keep this suction of, like a suction mask, kind of. It's strapped down, and it pushes air, and it filters your air when you breathe in and breathe out. It's kind of like a ventilator, to say. There is sometimes where special cases when patients have to use these later, more like every day, which then they go to different kinds of oxygen. Okay, continuing. The next thing is an oxygen canister. These two kind of go together. This one's an oxygen canister. You can get travel bags of these too. The oxygen canister, you can connect to multiple things. This is one of the basics. This is the nasal cannula. You'll see this quite a bit if you are in having the breathing problems and having issues. Okay, next one. This is an inhaler. A lot of people use this inhaler for asthma, and also if they just need that little, or like allergies or anything else that they would need it for. Respiratory fits into nature. Some positive impacts of nature is our green space, so living in more green areas like the picture below help us with our breathing functions, can help benefit our breathing functions, plus also it can help us when we get older, especially because our lungs aren't being as worked. Exposure, so being exposed to healthy microorganisms will improve your life mostly in the first 5 years. This also includes the immune system. The air quality. Having a better air quality can improve lung functions and increase asthma symptoms. And bad air quality can have high risk of many breathing related diseases. I'm gonna move my little thing. Some lessons topics about this could be your gas exchange. You could do a lesson about gas exchange, the anatomy of the respiratory system, learning about the respiratory levels, some health issues that you can come across, some lung experiments. There's plenty of different lung experiments that you can do. There's one where you have the water bottle and you take one balloon and then you take another balloon and you pull the balloon, and it's supposed to symbol your lung inhaling and exhaling. You can also do carbon dioxide test. Some of the grade levels that can experience this or are taught the respiratory system is anywhere from 4th grade to all the way up to the higher levels of education, depending on what you're studying in like college. Understanding the respiratory system. The idea that I can understand was that the meaning of the word respiration, is exchanging of gas. Respirations referred to the metabolical process by which cells take in the oxygen they need and give back carbon dioxide as a waste product. I did know quite a bit about respiratory because of my experience that I have had in the nursing field and family history, plus also my job at Blessing. These are some places to find more information about the respiratory system. There is plenty of topics and websites here. There's plenty more out there. These are just some of the ones I really liked. There's even a YouTube video, which you can watch if you want to, that shows some pretty great things, I think. Kind of gives you that simulation experience without like actually seeing it, like it being open. And then these are my resources for my slides. That will be it for my presentation. I hope you enjoyed it and benefit from it. Thank you.